of our patients, it's just equipping them to have the right mindset to really know, like, it is possible to turn your body around, even if you feel it's been, like you said earlier, broken or it's failed you. Well, the body has this incredible resilience to bounce back up from
Adrenal
that
Fix
injury.
podcast, where our mission is to tell the truth about adrenal fatigue to exhausted and burnt out adults so that they can get their energy back quickly. And today I'm really excited to interview my next guest, Dr. John Tait, who's the Chief Health Strategist for Rejuvenative Medicine Medical Southwest. After more than 15 years of medical training, including 2 fellowships and acquiring 3 board certifications, Dr. Tait saw how conventional medicine was failing so many patients. And after his own devastating injury in 2012, which left him looking for an alternative way for a potential 3rd spinal surgery, he found the solution and his true calling in functional and regenerative medicine. So, Dr. John, thank you so much for being here today.
Hey, my pleasure. Thanks for having me.
Yeah, so my audience are people that are exhausted and burnt out, and much like you, I had a devastating back injury myself. And so sounds like I'd like to know a little bit more about your history, your background, what got you to where you are today. So why don't you tell our listeners a little bit about your story?
Sure. Well, we'll just launch off right from February 2012. So I was a few years out in practice. I'd completed all that training, 15 years, school, residency, 2 fellowships. I knew a lot. My practice at that time was a integrative pain clinic I was working within, and we had a great model. We had a psychologist, had physical therapists. We were very good at doing interventions to alleviate pain, medications, interventions that we were injecting in the spine, or we'll say numbing nerves, deadening nerves, so people couldn't feel things, with joints in their spine. So we had a very good system built around that. And then I found myself on the other side of the table, in that month. And the backstory with my back is actually my first year of medical school. I herniated a disc in my back a few months before I was scheduled to start school. And I worked through conventional treatments, ultimately had a surgery of my L5S1 disc in my spring break of my first year of medical school. I was not on vacation in Cancun. I was getting surgery. So I learned a lot from that. Obviously, it was a pivotal kind of course correction in my training at that time, and walked that forward. Unfortunately, I had some issues with that a couple of years later. Went through the conventional rigmarole again. Came out the other side really good, and that was about 10 years until that February 2012, where I woke up that morning, had some symptoms in my leg, but I was committed to an event. I do a lot of hiking, and we were going to do a charity event, and we'd raised a ton of money with my wife to do this event, and I wasn't going to back out of the event. So I'll shorten the story, but I gave myself a pretty good dense radiculopathy in my leg over the course of hiking 30 miles that day, and landed back in my office Monday morning thinking, am I going to go through the same stuff again? The shots, the meds, and maybe ultimately a 3rd surgery. And I didn't like that view. So after a week or so of the what ifs, I got to work on the what now. How do I solve this without doing those things and find a different path out of it this time?
Gotcha. Okay, so it's always a learning process with your own health in order to help other people with their health. So as far as the model, I love that you had a psychologist to help with the pain presentation as well. But what do you feel, John, was the big learning aha for you in terms of once you said, okay, I don't want to go down that route one more time? What changed and what did you do?
Yeah, great question. I think what it came down to initially was, like we see in ourselves or our patients, we got to develop this mindset first of, was I a little bit fearful when I injured myself again? Of course I was. I knew all too well now at that time where this could lead for me. And it wasn't out of just a disdain for surgery or otherwise. I just felt that there was a better way to get my body to heal and recover this time around. I had already been spending a little bit of time in the functional medicine space. I had been introduced to regenerative medicine through my training with treatments like prolotherapy and platelet therapy, and we were getting now more traction with stem cell therapy and what that could do to help the body heal. So the first thing was just the mindset or the approach that I said, well, I know what the other version is over here, but I can play this out a little bit longer down this path and see if I can just get my body to turn the corner this time without those other conventional treatments. Um, and the second piece of it, despite us having all of that in our practice, what was really lacking and what's lacking in most people that train through traditional medical school is a deep dive on how the body actually heals and repairs nutritionally from a lifestyle standpoint. And I'm a DO, so we're a little bit more holistic maybe in our thinking. Not that some of my MD counterparts aren't, but I got an inside look at that in my training, but I felt that that was really the gap, and I knew it was because as I started exploring in that and saying, okay, I can't do all these physical things to get my body better. Like at this point, my nerve just had to recover from the injury I gave it. Going and trying to exercise it back into health physically wasn't going to be the way to get there. So now I started looking at the physiology because we spend so much time focused on the anatomy of the thing. What does that MRI look like? Or what does that knee look like on an x-ray? But man, these physiologic systems that you well know in our body that really turn the wheels on our body's ability to repair. So that's where I went down the rabbit hole, you could say, and it didn't look back. I mean, this is where just the whole world opened up to me with the next layer of functional medicine and regenerative medicine.
Yeah, it's a great story. I'm sure you're now overwhelmed with knowing now what you don't know in terms of understanding that there's this whole psycho, neuro, immuno, endocrine, gastro. It's really a back and forth communication system between all of those systems in the body. But going back to your injury, because I could really identify with that, and also with the listeners that listen to this, a lot of their domino effects were from trauma, whether it's physical, emotional, and then they have sort of a post-traumatic or even post-physical injury that can really debilitate them and can really not only cause pain, which I do want to get into with you today, because I want to discuss your natural approaches to pain and how all those systems help to contribute to getting better, especially with regenerative medicine and what you're doing. But back to you as far as, was there ever a time, John, when you said you were fearful? Was there ever a time when you were fatigued, exhausted, didn't have the energy, or it impacted other areas? Because as you know, pain impacts so many different emotional centers. But were there other areas of your body that, or of your systems, or just your health that were also impacted based on those reoccurring traumas that you were having?
Absolutely, and I'm glad you brought that up because it's a subject that not all docs want to go there into that space with their patients, unfortunately. And I think if we don't explore that biopsychosocial piece, or we're focused too much on the anatomy or too much on the biology or physiology, but we really don't explore the psychosocial dimension of what's going on. And around that time, I can say that my practice, it was not my dream practice. It was a very stressful position. I was grinding really long, hard hours trying to build a practice for myself. I didn't enjoy every bit of what I was doing there. So I was carrying a certain amount of stress, and my way of relieving the stress, like many of us, you included probably, is go pound the weights, and put actually more stress on my body in a good way, but also I saw cumulatively, looking at it in kind of this retrospective view now, the times in my life where I had those injuries and what else was going on in my life at the time. Was it this physical insult, or was this cumulative trauma psychosocial that, we don't, consider it a trauma, but it does affect these systems in our body. And there was this article that I read at the time. It's probably 7 years old now, I think. But University of California, San Diego, Robert Nevo, but he talked about this mitochondrial, basically the features of what he called a cell danger response. Like what happens when your body's under this trauma and this persistent stress, and what happens to the physiology of our body that goes into this danger response, where we get this mismatch between our metabolic system, we get inflamed, everything gets in that state where it's more vulnerable because we don't have the resources to repair. We have this inflammatory state that's compromising the function of the body, and the body breaks, or it can neutralize that cell danger response, that inflammation, and really start to turn the wheels on repair and regeneration. And it was very interesting to me at the time, like reading that, because it was just like, why is nobody talking about this stuff? Like this is super important. And this is what we're missing in my practice when we just keep injecting this thing because it hurts. We keep medicating this thing because it hurts. But what we're also changing kind of unknowingly, or maybe knowingly, when we accept it as the side effect of the medication, is that we're changing that metabolic machinery. As you well know, we start altering those things with pharmaceuticals and the taxing load it takes on our spine or on our body rather, to detoxify all that stuff. It's this cumulative effect. And then yes, maybe this physiologic thing or this activity I did was that really the straw that broke the camel's back, right? But I think it's really an underappreciated space where not everybody's comfortable going into that. To really, if I review the histories of a lot of my patients, the reason their body went sideways was this mounting cumulative stress in their world here, much more than it was a physical stress that broke a part of their body.
Yeah, no, awesome stuff. I mean, I'm glad you referenced that. And tomato. I know I've heard it as Robert Naviau. I don't know if it's
Yeah.
right. So,
Yeah.
but he has a follow-up report. I don't know, or his most recent published peer-reviewed study, beyond the cell danger, which I had to do a lecture for an environmental conference, and I didn't know what it was with mold, and it was getting into genetics, and I was telling the truth about adrenal fatigue, and I was really stressed out about it, about what am I going to talk about. And I said, well, let me go to the cell danger, because I think that's awesome. And just as a side note, I think that it really sheds the importance of, even though specialties are great, the body's a generalist, and the specialties need to talk to each other, because the body's doing what it should under the stress load that it's undergoing. It's not necessarily broken per se. It just needs a new paradigm to understand why it's doing what it's doing. And it's a cell danger response to prevent more danger and to reduce the inequality between supply and demand. But the new paper, John, is awesome in terms of, it says that the body gets stuck in healing responses. So it's not able to go from one phase to the next phase to the next phase. And when that happens, you have incomplete healing. And then you have more likelihood for, at least at the 30,000 view foot, more likelihood for damage structurally and re-injury and pain, for sure. So that's an awesome paper that you referenced. And so as far as, I guess the question that I would have for you is, how do you apply that now to what you do now? Because as far as we see, pain is such a huge comment, or I get people, hey, I'm in a lot of pain. I have a lot of pain. And ultimately there is that reductionistic approach where I want to just take something and make the pain go away. And I don't mind that recommendation, as long as you're understanding the entire clinical picture and what are all the things that are contributing to the pain, so that you don't rely on those pain things to help you. So as far as that, I guess the question would be, what's your approach now? How do you balance the what you need to help your clients with now, with maybe getting more to the root cause or addressing upstream mechanics so that that may take, how do you balance the two?
Great question. I mean, there's a lot to unpack there, and back to your other statement about that, body getting stuck, in that like that healing phase, or I think, I think the phrasing they used in that article is like a metabolic, memory of past, stress encounters or something like that. But it's like these pathways get kind of grooved into your system, especially with people that have pain. We look at the processing of
Addiction
pain and
almost, right? It's all, I think they reference it as metabolic addiction too,
yeah,
where you have the same, sorry to interrupt, the same chemicals that get released, for better or for worse, your body kind of gets used and addicted to that. I think that's what he was saying.
yeah.
But yeah.
Yep. And so it can really alter these fundamental pathways, as you know well. And, we talk about just mitochondrial function of cells to be able to produce energy, to get the momentum to actually repair, or the macronutrients we need to deliver into these cells to give them like the substrate, the literal building blocks so they can repair. And none of that stuff, as I, went through all the training that I did and came out of my injury over the next, 12, 18 months studying this, to the point where I said, I'm not going back. Like literally, like I'm moving on and I'm starting a practice built around this other methodology, because it's not, to your point, like a this or that thing. It is that some patients need that. And I tell my patients it's kind of training wheels. Until we can get your body in balance to balance on its own, some people need those training wheels. They need a little medication to just get them out of that pain state. Because if you're in that pain cave, it's hard to function, man. It's hard to think. It's hard to have energy to do anything. But it is a fine balance, because we know it comes at the expense of compromising gut function, cognitive function. Because I can tell you, when I was on those meds, I went back into my practice that Monday morning after that hike, and my partner's like, man, you're in a bad way. Let's get you going on some stuff. Started prescribing things like, Lyrica, and getting me on these medications to maybe help, with the nerve pain I was having. And I was driving to work a couple of days later, like, man, I was holding the wheel, but I felt like my hands weren't on the wheel. It was weird, like out of body, like, whoa. Like, and this, like, now I'm like realizing what my patients feel on a regular basis. Like they don't like the way they feel on this stuff, but they don't know what else to do. So they got to take it kind of approach, because that's what's being literally fed to them through pain clinics and other things. And those docs are well-meaning. It's the tool they know how to use. So they use it, right? It's not that they're ignorant of this. It's just like me. If you would have met me 8, 9 years ago, I was knowledgeable of some of this stuff because I was always plugged in taking care of my health, but not at the level now I understand it, to help people, uncouple some of those like just links that they've had there to either that metabolic chaos in their body, the physical like adaptations they've made in their body, the decompensation of their movement patterns. And so those are all things that, in my process, we start to think about, how do we get your body prepared to get out of this state? Like all of us, like if we were going to go out on, an adventure in the mountains, and we're not well versed at the path ahead, we would do some education. We would learn, we'd get some maps, we'd sit at base camp for a while, we'd study our route, we'd do all those things. We wouldn't just like spring out in the mountains with no equipment. And so a lot of our patients, is just equipping them to have the right mindset to really know, like, it is possible to turn your body around, even if you feel it's been, like you said earlier, broken or it's failed you. Well, the body has this incredible resilience to bounce back up from that injury if we start to then put the right things in motion, which is now we talk about how do we activate some fundamental things for the patient in their lifestyle. Many people were not taught and educated how to sleep, how to build more stress resiliency, or what a healthy diet truly looks like, and how that can be different from one person to the next. So we got to get into all those things. And then obviously that segues into now what I do with a lot of people in the functional medicine piece, is really understand the deep inner workings of their body, where they're deficient nutritionally to get their body to heal, what's going on with their gut, because we know that's such a gatekeeper for everything else. Look at, immune system reactivity by getting different tests, because you see this all the time in your practice, I'm sure, with chemical sensitivities, mold sensitivities, all these things that start to rob energy from the body's ability to repair and regenerate. And so it sounds like a lot, but the system is pretty clear for getting the right pieces in place to help people have the opportunity for their body to heal. And then I nudge them over on this side when we get into the regenerative space to say, now if we got the foundation set, man, and you got the path, you're walking the path, you're doing pretty good. You don't have to be perfect, but 80% of the time you're plugged in and you're doing this stuff. Cool. Now the machinery is going to start moving in the right direction. We got your mindset machinery working the right way. We got your body's machinery working the right way. Cool. Now we can give your body a nice nudge, and an assist to really heal if it's a specific tissue in your body that is physically injured and torn, or, has aged or degenerated to some degree. We can start to turn that clock back a little bit, or at least level out the slope where somebody's not declining so precipitously over time.
Yeah, I know there's so many things that are going off in my head. I'm like, I'm not going to remember but what I think of is it must be a fine line, John, when someone's injured and they're debilitated and they have major pain and they want to get better, and you have to not necessarily show them what they need, but kind of give them what they want, right? In terms of, okay, they want to get out of pain, but I don't want to tell them like, hey, your gut health is messed up. We got to balance your blood sugar. Ultimately, that's what led to this injury being much more likely, because the water is getting to the overflowing part of the cup, and then the proverbial straw that broke the camel's back resulted in structural damage and injury. And there's a lot of things going wrong there. And so I could see that. And I'm really hopeful and excited to hear that that's where medicine is getting towards, which is awesome, because, but at the same time, you have to graduate them slowly. And that the other thing I was going to mention is, it's like it's gotten much more sophisticated now, where with rehab, it's usually a progression from acute to subacute to more a chronic thing, or it goes from passive to active to more evolved in terms of the rehab. But it's kind of the same thing now, except just at a much more cellular, mitochondrial, all-encompassing level. Number one, those are the things I think of. The other thing I think of too is, I remember when I injured my back, and I don't want to make this about me, but I went for an MRI, and it was a 2.5 centimeter herniation. It was a really big herniation. And I still have a little bit of numbness and radiculopathy on the outside of my right foot. And I remember, like, I didn't want to take medication, but I would be like in tears driving to work. I'd be on the bathroom floor in between patients. I'd be like at a Starbucks, and it would be like I'm taking a crap sitting down the way I was, because I couldn't stand in line. It was that painful.
Yeah.
And I remember I finally got a prescription for like a narcotic for pain. And I remember, not like you in terms of feeling outside of my body and not really feeling my hands on the steering wheel. I remember thinking when it kicked in, it was like, okay, I could see why people like this, like this is definitely like, I got some endorphins going here. I don't have the pain. It feels good. I kind of have like this little, good euphoric feeling. But when that would wear off, I would feel nauseous, and I didn't even want to take it anymore, because that nausea and that really tearing up my stomach was worse than the pain, of what I was feeling. So lots of clinical nuggets that you shared with me there. So as far as how do you manage the educational process, I guess, I mean, is it one of those things now when they come to see you, they know that Dr. John's regenerative approach is going to include the education of how my whole body's involved for me to make a complete recovery? Or is it more of they didn't really realize that until, you kind of earned their trust, got them out of pain, and then kind of educated them on, okay, here's what you really need? How do you go about doing that?
Yeah, it's a great question. I think it's, as we do often in our practice, we got to meet them where they're at. Some people come to me, they just have a problem, but they're not very solution aware. but they know I do things a little bit differently, and they did enough research to say, hey, this isn't just what I've been fed with repeat cortisone shots and medications, and this guy's doing a little bit different version. And some people are very solution aware. You know, they've done some research, they've studied things like platelet therapy or stem cell therapy, or they're somewhat knowledgeable about functional medicine, and they've even had some testing elsewhere. But I think the gap is really connecting the two pieces, because I have plenty of colleagues that are just amazing regenerative docs that just focus purely on the injection interventional side of it. And they don't really explore the nutritional side or the biopsychosocial stuff that we were talking about. And they still get great results with their patients. But I know when we integrate these two worlds, what I leave that patient with, regardless of the outcome, because there are some cases where, you know, we can't turn that tissue around. You know, somebody's been beating up their knee for decades and it's an end stage bone on bone knee. Some of those I've been able to turn around and have that person avoid a knee replacement. Some people they can't. But what I tell all my patients, the promise, we're going to make you healthier in the process, right? You're going to graduate out the other side of our treatment, knowing how to take care of your body, knowing the right testing to get periodically to look in on your body. And I think that's huge for people. And it's meeting them at that place where they are and saying, like, let's just take the biggest step that you're able to today, and we'll just keep adding some steps down the path as we go. We don't have to make a landslide shift of your entire world when it comes to nutrition. But I look for, like you do, where are those needle movers that, you know, we can just take the slider and move it a little bit over here to make it better. And that's going to start to get some things clicking in their world where they can feel it. Because to your point, when somebody's in just that state where you were, just like miserable, it's going to be really hard to sell them on, hey, you know what, I want you to go home and prep every single meal and make it from scratch, and I want you to do that, right? Like this whole laundry list of things that sometimes we unload on patients because we're so excited about getting all that going in somebody's world, because that's what we do in functional medicine. But it's kind of bringing it back to the piece where it's like, okay, that's doable. I can start with that. And so for me, a lot of times I'm just like, let's get your sleep right. You know, let's really focus there. It's not going to take much effort other than getting you into bed every night, but work on the hour before bed. How do we get that routine, that systematic approach where we can get you sleeping better? And sometimes the pain interferes with the sleep, so we may have to use some tools there to help with the pain. But alongside that, we're like, okay, let's get that rhythm going again. Let's get your body into a deeper sleep state, because that's where it does heal and repair. And we know that if people are shortening that sleep interval because they're in pain, it's disrupted all night, you know, they're robbing minutes or hours even of time that their body is repairing. And they just keep stacking that stress day after day. And they really don't get that time to repair. So it is a tricky question, but it's very personalized to the patient and what they're, you know, willing to do. It's always like, okay, where can you meet me on this one? And what do you think is doable? Like, what's that process goal we can set for you for the next couple of weeks or to our next appointment? That, hey, just if all you can work on is getting your sleep dialed in, let's work on that. If you need those medications for now, that's okay. You know, our goal is to get rid of those in time if possible, but sometimes we need them. Again, those training wheels to make things a little bit more doable.
Yeah, I know it's a great answer. And I think it does come with expectations, right? In terms of meeting expectations, setting goals, and asking them, okay, well, what is it that you want out of this? You know, like, what if we can address whatever it is that's missing from your life beyond just the pain that you're experiencing and the function and the limitations? What are your expectations? And I think that's key. I would be surprised, though, to do a study between just the regenerative doctors that don't focus on all of that, that get results, and someone like you in an integrative functional medicine, look at everything and set goals and expectations and do the same stuff. I would be surprised if there wasn't a significant difference between the two. What are your thoughts on, in terms of the outcomes, in terms of the response, you know, in terms of the increased functionality? I don't know. Is that what's your sense on that?
Oh, you're on target, because when I look at my personal data in my own practice, where I walked into this, fairly knowledgeable, but built more systems, more structure. The way we do it now, like our, I guess, proprietary process of looking at things and embedding these things and doing it alongside of our treatments, no question our outcomes changed, and both how quickly people responded to treatment. Okay, but also more or equally important for patients is the longevity of this treatment, right? So if I'm getting a treatment, I don't want to be back in a year getting more treatment if it could potentially stretch 2 to 3 years because I'm working on some of this stuff over here. So, I mean, that's how I position it for my patients is like, man, wouldn't it be fantastic to get out of this situation, but not have to come back? And maybe this is like not the best financial model for my practice, because if I didn't teach them those things, then they'd be back every year, right, to get more treatment. But that's just not who I am. And I want people to understand, like, man, if we can unlock this system for you where you just know where to put your energy, you know the path to walk, and man, you commit to it. It doesn't have to be 100%. But if we go to the other side of that, and your body's in this state of chaos, you're in the middle of this like danger response or whatever we want to call it, this metabolic chaos. I tell patients, if I were to take cells out of you right now in that condition and inject them right back into you, how well do you think those cells are going to work? Right? I equate that to taking your cells and throwing them right back into like a wood chipper, right? It's like, it's not going to work that well, because the whole thing of how these cells work is predicated upon how healthy you and your cells are to signal one another to say, hey, we need help over here. Let's get to work repairing. But it's like, these forest fires that, we've read about out west here. It's like, man, if you're battling them on multiple fronts, you can't channel your energy right here where it's needed to really put this one out. And if we're trying to put out the fire in your knee, that's just killing you because of this arthritis or whatever it is. But you got all this metabolic chaos burning in your body everywhere. Man, like, we'll probably still get a result. And I know we will, because I trained in practices where they still got results, but it doesn't come as quickly. It's not as robust as it would be. And it certainly doesn't last as long.
Yeah, it's a good point. I never really thought of that in terms of the frequency, right? The frequency of the body and at all cellular levels. And if you have a really unharmonized, disjaded frequency, it's going to impact the stem cells. It's going to impact the ability of the PRP and the platelets to be effective. It's a really cool thing. I never thought of that. As far as lots of questions, if you're okay with me asking you all these
Go
questions.
For it.
I find that it's very, very frustrating, John, because when I help some of the, like, let's say the train wrecks, right? In terms of the perfect storm, they got crazy genetic susceptibilities with the most crazy environmental realities, and it creates this perfect storm. And in your case, it's an injury and it's a trauma and it's pain. And then a lot of doctors that are specialists that they've been to aren't talking to each other, and they're not communicating. And then that person has a slippery slope of prescription 1 through 5. And then now they have the prescription 6 to take care of the side effect of prescription 1. So how do you manage that? I'm curious to know as a colleague, but also in terms of, people that are exhausted and burnt out. And what they might ask is like, yeah, my doctor puts me on all this medication and it kind of helps, but I'm still in pain. I still have lack of motion and movement. I feel terrible. And I don't know how to get off this or what the solution to that is. So I guess it's an open question to answer however you want.
Yeah, I mean, it's a good one, because I think, sometimes there's this polarization between these worlds of like, okay, conventional medicine's over here and it's all evil because they just feed you medications and they just, they're in cahoots with the pharmaceutical companies. And you can see a lot of that out of certain sources. And it's like, and then over here, it's like the other extreme version of like, you got to walk this fine line. You can never even take a smell of bread baking because you're going to be poisoned with gluten just by exposure there, or whatever it is. That's like this very extreme edge, and we know how genetically susceptible people are to things like gluten. And I'm not trying to downplay that, but most people can't live on that razor edge of what some people in functional medicine say is required to get better. And it almost sets the patient up from the front end for failure because it's just not anything that they think is achievable. Like, oh, Dr. Tait, you're just like, you must do hours of work a day on yourself and have all, and it's no, I've built better systems over time where things have become more automatic for me. But if you don't have that knowledge and that foundational knowledge, like I did to even understand it to begin, we got to get you to that point. And then again, what is doable for you and walk you forward. But when it comes to the relationship with other providers, depending on where they are on those two ends of the spectrum, it's challenging, right? Because I have had patients that are co-treated by a functional medicine doc or naturopathic physician or somebody in that space, and they're running their playbook with the patient. And then you have the conventional trained doc over here who's maybe a rheumatologist taking care of the patient with his tools or her tools. And the patient's trapped in the middle of these worlds. And then they come to see me, and they add a third provider to the mix. And then it's like, to your point, how do we all talk? Because in my training as a physiatrist, physical medicine rehab doc, we did these rounds in the hospital where we had all the people at the table. We had your primary care doc. We had the subspecialist over here. We had the various physical therapists or occupational therapists, psychologists, the whole team sat around a table and said, how do we get this person better, independent, home and out of this hospital? And that was our focus. But, as we know, when we get out in these worlds, when we're all in our own private practices and the communication isn't there, what it creates is a lot of confusion for the patient. So without the communication, there's so much confusion. And I think it's a really challenging thing. And I think the only way I've approached it is telling patients like it's not an either or thing. Like I read an email this morning of a woman that said, hey, can you help me get off these poisonous medications my rheumatologist has me on? Well, no question. If we look at how some of those medications work, I mean, some of them are chemotherapy agents, right? It's literally a poison. So I get what she's saying. But man, if we're going to pull her off that and think just giving her like a curcumin capsule is going to fix her inflammation right now, it's not going to happen. She's going to be in a world of pain. So we need to bridge that gap and ideally bring that person into the conversation. But I'm sure you've found that challenging in your practice. I find it challenging in mine to get providers that understand enough of what we do to not find it threatening, but we can really integrate those two worlds and say, okay, the patient needs to be seeing you for some of that treatment. I'm going to be working with her in this space. And collectively, aren't we all on the same page trying to get this patient better so she can live more functionally, have less pain, and have the best quality of life she can? And if you're threatened by me teaching her about nutrition, like, it's just kind of, then it does become ignorance, because that's all I'm doing is working with your patient to help her understand her lifestyle and her nutrition better. Something that you're not really focusing on, and I don't expect you to. So it is that dance we got to walk sometimes, because I think they'll look at things through a different lens that may be useful and complementary to what I'm doing. It's not all bad. And I think when things are presented that way, it can be a disservice to patients to think like they got to pick one of the two worlds. Either I'm all in over here on the integrative functional medicine side, and I'm just going to pull myself off all my medications without telling my doctor and go over here. And that can be really detrimental to some people. And I'm sure you've seen those quote train wreck people come in who have done that to themselves, saying, I don't want that version. I want this healthier version. And they've tried to cobble together this system, but they need an expert like you. They need an expert guide to guide them up that path if we're going to get them where they want to go. So I'm still challenged by it in my practice to find people, in my community that really understand what I do, really understand that I'm complementing what they're doing. And over time, sure, it may minimize some of the work they need to be doing. And I see this sometimes, that we just got to form the network of people that get it and want to work together collaboratively. And the folks that don't get it, I tell the patients over time, you may just want to look elsewhere to find somebody to do that component for you.
Yeah, no, it's a great answer that you have. You spoke about it earlier in terms of the entire integrative approach. I think that the point I was going to say earlier with that Navio study that you've cited is that at the end of the study, he talks about the book of medicine, the second book of medicine being written. The first one is the acute based, which was great. And the second one is more of the not so much the chronic based, but the life cycle of healing that isn't going to be applied with the same acute based approaches. So it's a paradigm shift, and it's an educational shift, and for patients and doctors alike. And I think that doing stuff like this and having a podcast, because I know, like, if I have a client who, when I used to do more brick and mortar and come in and they didn't know what gluten was, I did a bad job of, like, we can't talk, like, no offense, but we can't talk. Like, I got too many other things that are going to go over your head, and you're not going to understand. And if you don't know that, and I think that's our responsibility as providers to educate, because that's what a doctor does, is they teach. And I think that if they're not asking the right questions, which in today's day and age, John, I'm sure you see it, the patient is much more sophisticated. They have a lot more knowledge. In fact, at a fault, right? They're going too much into the research. And I let them know, I want to free you of that. I don't want you spending valuable energy doing that, because if your weak link in the chain is musculoskeletal pain and inflammation, you're going to only add more fuel to the fire in that area. And it's going to manifest as joint pains or brain fog or headaches. So I like what you're saying in terms of, it's a fine line. We can only do our best to educate. And I like expectations in terms of, what are your goals and how can I reach them? And does that make sense? Are we a good fit for each other? Maybe I'm not a good fit for you. And I've also said too, what you've said is, I'm team patient. I'm not team Joel, or anti John. I'm team patient, So what I want is, I want to do what's right by you. I think that I'm open to a dialogue with that other doctor and let them know what I'm doing and how what they're doing can complement what I'm doing, or what I'm doing can complement what you're doing. And let's get the patient feeling better. And unfortunately, not all doctors are there in that mindset either. They're insecure, or they're jaded, or they're just tired, whatever it is, So the other question I wanted to get into, if you're open to it, is regenerative medicine. So what exactly is stem cells? What are platelet, PRP? What is that? What does it do? And how does it facilitate healing?
Yeah, it's easy question and can be a broad answer. So we'll keep it at a high level today. But your body, the default mechanism of your body is cellular regeneration, right? Until you take your last breath, that's what your body is doing for you. It's remarkable, right? That these cells just turn over and repair these tissues over time. Now, what we know as we age is our ability to turn those cells over slows. It can be compromised by some of the things that we're talking about, depending on this like allostatic load of stress that's on our body every day. It's going to compromise and grind up that time faster for people. But if we get them recalibrated the right way, thinking the right things, doing the right things for their body, okay, now let's look at what these cells actually do in your body. So everybody's cut their finger before, and it bleeds. And if it's not a super deep cut, it clots and it stops bleeding. But internally, what's going on there, when we cut through some capillaries to get some bleeding like that, we're releasing these different cells, and we see the red blood because there's red cells there. But what we can't see is the white cells and the platelets usually. But platelets have these reservoirs of growth factors within them, and they're released into that environment, and your cells chemically communicate and talk to one another. And so the injured tissue is telling the other cells in your body, you're injured, number one. Number two, you need some help over here cleaning up the mess. And number three, over time, we're going to have to repair this mess. And it's nothing we have to think about, right? Our body is like beautifully designed to do this for us. And over a few days or a week or a couple of weeks, we can no longer see where we even cut our finger, right? Completely healed and mended itself. And so, in the 1990s, what came about is the use of this really in a lot of facial cosmetic surgery, dentistry for like these, things they were treating. And then it started to spill over into the orthopedic field, where The mechanism of healing, we know, goes through these stages of inflammation and cell recruitment and repair and strengthening and remodeling. But we could induce these responses in a tissue that said, or say, failed to heal over an expected length of time. And now we could go in there and needle that injury with these growth factors, really deliver it to the site of this injured tissue and stimulate a healing response with that tissue. So that's very briefly how platelets work. Stem cells in our body, that are found in multiple sources. They can be circulating in our bloodstream, but they're held in the reservoirs of our bones, our bone marrow. We also house some in our adipose tissue, our fat tissue. There's a fraction of stem cells. And these are much more powerful than platelets because the old school thinking was this cell would interact with this environment where it was injured. So we're giving off this homing beacon of injury, and these cells in our body migrate and are attracted to that signaling that's given off, and then this stem cell can literally convert into a new cell to help that struggling tissue. And then around 2013 or 14, we realized that beyond just this cell differentiation, as we called it, there is this process by which our cells are releasing these packets of growth factors with a kind of a blueprint, that it's sending on its way. Hey, here's the growth factor material and the blueprint to grow some new things. And we called those packets, or they did, exosomes. So our stem cells release these exosomes into the environment. And now we can have a one-to-many cell response. And that's really where things have taken off since that time. It's just like hockey sticked up with all the different biologic products that now we can acquire from various sources and take them from the patient. So taking them out of your cell reservoirs, whether it's your bone marrow, like in the back of your hip, your ilium is where I harvest those from, or your adipose off the flank, or drawing your blood and getting platelets. But they all induce this amazing healing response. And if our body is set up the right way, and then we put these in there, it can really nudge this tissue to turn around. And I've seen cases of people that are bone on bone, slated for knee replacements that we've treated. I talked to a woman the other day. She's 80% better, happy as she can be. Her x-ray still looks horrific, but because it's not going to grow an entire layer of cartilage back in her knee. But I tell people it's much like the crappy roads around your town, if you have any. They don't always go out there and tear the road down to dirt and rebuild it. What do? They top coat it. They fill in the potholes. They seal it. It's the same thing. If we got these cracks and potholes in our cartilage, we can fill those. We can decrease that inflammatory chaos in your joints so you don't feel as painful. If it's a tissue like a ligament or a tendon in the shoulder, that tissue's partially torn, we can get it to heal and mend itself. So, I mean, it's really cool, and it's been a game changer in the orthopedic field over the last decade plus, that we can now do these things that are so far less invasive than a surgery, because many of these people unfortunately get stuck in this middle space where it's like, okay, you can take medications, you can get cortisone shots in your knee, but it's not working anymore. And maybe the patient's too young, they're in their early 50s, and they say, hey, you're way too young to replace your knee. I don't want to, the doc surgeon rightfully says, hey, if we're going to replace your knee, we want it to last a long time. If we can only get 20 years out of that knee, we should wait, replace it later. So what do you do in the meantime? What do you do for the next decade? Just, again, back to our point earlier, do you just stay miserable? Or is there something now that we can do interventionally? And this is something that really a lot of those patients I see are in that middle space where it's like, man, I don't want the surgical option, or I'm too young for it. I certainly don't want to live on medication forever because they're not really working. They make me feel terrible, or they're tearing up my gut or whatever. This gives us just a plethora of tools now that we can use to really target that injured tissue.
No, that's great. And I think that I can see why that Navio, like I was thinking, like, as you were saying, that should be required reading for any regenerative medicine practitioner, any practitioner for that matter, but specifically in the rehab and the regeneration of tissues. But you kind of went upstream and thought about the cell danger response to why in the first place the body kind of broke down as it did as well, which kudos to you for doing that. I always like to ask my clients this or my clients, the people that I interview on this podcast, this last question that I think is really helpful for the listeners. And it's, hey, Dr. John, knowing what you know now, because you can see your knowledge and you've put a lot of work into this and you have your own personal story and you work with people one-on-one. So it means a lot to hear your answer to this. But what would you say to the young, maybe easily breaking down John, or even the misguided John, or the John that needed the older, wise, sage John to give him advice that you know now? What would that be? What would those words of wisdom be to the younger self now?
Great question. I think it's the most impactful thing that I'm doing now in my practice is trying to get to people earlier in their life. Like, to that point, if I could go back to that time and say, man, like, you're driving really hard in these areas, you're building a practice, you're doing this, you're training at a high level, because that's what we know how to do. And we have that resiliency in our 20s and our 30s. And at some point, though, if we're not deeply taking care of the right things in our world, whether it's our psychology, our relationships, our health, or nutrition, and there's plenty of physicians, as I know, that aren't the healthiest specimens in the world, your body will get to that point where it will stop you, right? It knows you're not giving it enough attention, and that, or whether we call it the cell danger response or whatever it is, it's a breaking point. Your body cumulatively keeps the score, and if it knows you're not giving it enough, at some point it will shut you down, right? So that is the thing that, man, if I look back in time, and the things that we put our effort and our energy sometimes into that are beyond our control, or the things we let get us frustrated or stressed in our work, it's really, now I've done a lot of work in the last decade to understand that, and now learning more, I guess, Stoic philosophy of like, what really is in my control, what isn't, what actions, what mindset can I have about how I approach my day, and not waste time, because that time is such a finite resource of like, man, what am I giving my time to in my practice, whether it's my patients, am I working with the right people that really like what I do, value what I do, and we have this great working relationship, or is it this tug of war? Or maybe it's people that are in a business, and I have a lot of young professionals that are very successful in their practice, but their body is beat up, it's fatigued, it's worn out, and these guys are in their late 20s. And I'm just like, whoa, like we gotta intervene now, because what are your 40s and your 60s going to look like? So I think it's a deep question that has to be very personalized to that individual. But it's what we do, like you said, we're teachers. We want to pass our knowledge that we're learning and studying. Like you said, there's so much out here in our space, but bring it all the way down to just the fundamentals. Because I think what I see the miss is as things have exploded in the world of biohacking and everything else that people are into, and there's some really cool stuff out there, but people are leapfrogging over just the basics,
Yeah.
and they're grinding too many hours. There's not enough reset time in their day, not enough reset time in their weekend. There's just this imbalance in their life, and like identifying that earlier can keep the body from getting into that breaking point, and just really keeping it simple on the foundational things. Like, what I do more than anything is pull people off supplements rather than add more to their list. It's like, hey, let's have a reason for all these things we're using, and make it sensical, test some things instead of guess, and really get a playbook that you can use that's going to pay you back year after year after year for that time that you're putting into those things. But it's, yeah, I don't have a perfect answer to that, but I think for me, it's like, man, I was driving a lot of energy into the wrong places, and thinking about if I would have just channeled this energy somewhere else, like how much different it would be.
Well, you're talking about wisdom, that's what wisdom is. And you wish you would have had more wisdom before you had to go through the trials and tribulations that born wisdom, and it's kind of like a catch-22. I get a couple of ideas in terms of, did you ever read that book, Who Moved My Cheese, by Spencer Johnson, I think his name is. It's a very quick read.
Okay.
And it's about these mice that have this station where they have cheese in there every day, and they put on their running shoes and they go in there and they get their cheese, and then they expect it to be there. And I think their names are Hem and Ha, right? And so they finally, one day, the cheese isn't there and they're hemming and hawing. But the thing is that they weren't taking stock of their surroundings, and they weren't aware of the changing nature of demands in their body. And it's really like, who moved my cheese for the body, so to speak, in terms of understanding the load that stress plays on your body, and being aware of it. Because it's no surprise, you know, that when you do break down, you're not going to avoid it. And you look back and you kind of play the movie reel of your health. You see there's no like big surprises in terms of why did this happen. You know, late nights, coffee, poor nutrition, lack of activity, bad mental processes. Just it's not a surprise. So look in the mirror, take accountability, and maybe get a little more wisdom before you have to go through some of those major trials and tribulations, I think. So as far as Dr. John, great information. How would I, if I want to learn more a little bit about what you do, how would I find out about who you are, where are you on the social media or on websites or anything like that? How would I get in contact with you?
Sure. On social, Facebook and Instagram, it's just Dr. John Tait, JOHNTAIT. My practice website is rejuvenantive.com. So REJUV, medicalsw.com. There's a lot of different things we have on there. You know, to get people understanding this world, you know, I wrote a guide for, you know, just a consumer guide to regenerative medicine. If people know nothing of this stuff and they want to learn the basics, you know, we have some, you know, simple things like that on our website that are totally free resources. People can download those, you know, start to just learn that there's other things out there than maybe they've been offered because they just haven't been in the right clinics, right? With the people that know these things exist, right? I still encounter many primary care docs, physical therapists, chiropractors, doesn't matter what their background is, but some of them have never even heard of this stuff. So I think that, like you said, we have everything at the tips of our fingers online now, you know, and it's almost we're saturated with information, but sometimes we're still not finding the right information.
Yeah, no, absolutely. Well, great information, John. I appreciate your time. Wish you future success to you and your family and your practice and the clients and patients that you work with. And when it goes this well with the podcast, I always leave the door open for you to come back for another interview. So I appreciate your time today, and I wish all the best to you in the future.
No, my pleasure. It was a lot of fun, and yeah, I'll certainly be back anytime.
Awesome. Take care.